Alcohol addiction or dependency is a serious disease. Not only can it break apart a family and bring financial ruin, but it can also lead to the alcoholic's premature death. Hence, it is important that the person suffering from this disease find immediate assistance. Through help, healing and returning to regular, healthy life is almost unlikely for a person with alcohol addiction. This video talks about how to choose the right alcohol rehab center, the support of an alcohol rehab center, medical evaluation, psychological evaluation, therapy, detoxification, and extended care. Some of the keywords include alcohol rehab, rehabilitation, addiction recovery, addiction treatment, alcoholic, alcohol abuse, healthiest mind and body, etc. If you are new to Healthiest Mind and Body channel, welcome to our channel and please subscribe for more interesting videos like this. Alcohol addiction is a serious disease. Not only can it tear a family apart and lead to financial ruin, but it can also lead to the premature death of the alcoholic. Therefore, it is vital for a person suffering from this disease to find help immediately. Without help, it is nearly impossible for a person with alcohol addiction to recover and return to a normal, healthy life. Choosing the right alcohol rehab center. An alcohol rehab center is the best source for a person looking for assistance with addiction recovery. Therefore, it is necessary to determine the type of rehab center best suited to the individual's needs. There are two forms of help a person with an alcohol addiction can receive from a rehab center: inpatient and outpatient. With inpatient treatment, the patient remains on the premises of the alcohol rehab center. Outpatient treatment, on the other hand, permits the individual to continue with his or her regular life while still reporting to the rehab center for assistance and guidance. The majority of alcohol rehab centers offer both forms of treatment. The support of an alcohol rehab center. Regardless of the type of program, the person with an alcohol addiction follows, the basics of alcohol rehab remain the same. In all cases, the addiction and other difficulties the patient faces are kept confidential. In addition, the rehab center will also include 5 primary components: a medical evaluation, a psychological evaluation, therapy, detox, and extended care. The medical evaluation. The medical evaluation conducted by the alcohol rehab center is meant to help the staff identify any physical problems the person with an alcohol addiction may have. Often, these physical problems are actually caused by alcohol addiction. Problems with the liver, for example, may have developed as a result of the addiction. After medical problems have been identified, the staff of the rehab center can work toward making the patient physically healthy once more. Improving the patient's physical health is an important component of addiction recovery. This is because it takes a holistic approach to get an addict back on the road toward recovery. This includes taking care of the patient's physical, mental, and emotional health. Without this 3-pronged approach, the patient is more likely to fail in the process of addiction recovery. The psychological evaluation. The psychological evaluation also provides the staff of the rehab center with volumes of important information about the patient. The psychological evaluation helps the team better understand the patient. In addition, the team of specialists can determine whether the person suffering from alcohol addiction is also struggling with certain psychological problems. For example, it is common for a person suffering from alcohol addiction to also suffer from depression. If this is the case, the program developed to assist the patient will also include a plan to address this issue. Therapy. Generally, an alcohol rehab center will provide both group and individual therapy to its patients. The group therapy is designed to give the person with an alcohol addiction support from others who are experiencing the same difficulties. Being able to share in the struggles with those who can truly understand often makes the process easier for a patient to deal with. Nonetheless, individual counseling is also critical to addiction recovery. Having the opportunity to work one-on-one with a counselor helps the patient work through his or her own individual conflicts. Through individual therapy, the patient can come to terms with his or her addiction and work through ways to resolve it by setting individual goals. Detoxification. In addition to the medical and physical evaluations, patients of alcohol rehab centers generally undergo a 24-hour medically supervised detoxification and withdrawal period. During this period, the patient is forced to go without alcohol. For many patients coping with alcohol addiction, this may be the longest time they have gone without alcohol in many years. The detoxification period is difficult for the person suffering from alcohol addiction because it is accompanied by extreme withdrawal symptoms. These symptoms take their toll on the patient both physically and mentally. For this reason, an alcohol rehab center also provides close patient monitoring and assistance during this period. Extended care. Extended care, which is also sometimes referred to as aftercare, is vital to the success of addiction recovery. Through an extended care program, the patient continues to receive support and assistance from the alcohol rehab center after being released from the more intensive alcohol rehab program. Extended care programs are designed to help monitor the patient's success in alcohol addiction recovery. To do this appropriately, the program staff watch over the patient to be sure he or she is utilizing the new skills gained during rehab. For instance, the extended care specialist may work with the patient to be sure he or she is staying away from specific crowds of people that encourage drinking. Or, the extended care specialist may check to be sure the patient is utilizing appropriate resistance skills. Without a strong extended care program, it is easy for the patient to fall back into the cycle of abuse. Thank you for watching, and if you liked the video, give it thumbs up and please subscribe to Healthiest Mind and Body channel for new videos every week. We'd love you to catch up on our latest uploads below and connect with us on social media. Facebook, Healthiest Mind for Real.